Hello everyone, welcome to a new session of Educatus, and today we'll be discussing about the advantages of breast milk. Especially we'll be talking about the importance of the breast milk and the macronutrients that is present in the breast milk. Our videos will not be so frequent because, as you know, the summer vacations are over now and the schools are all open. So I'll try to give you videos quite often, but it will not be like one in a day. So stay tuned to Educators and support Educators. So first we'll talk about the health benefits for a baby, like why we are focusing on exclusive breastfeeding, why we will talk about breast milk is the ideal food, because it provides all the necessary nutrients that is required by the baby, and the baby's requirement, the stomach size of the baby is just like an apricot, and it gradually increases to a size of an apple maybe. So that is why it determines the quality and the quantity necessary for the babies, and also it is the ideal food because it is contamination free, it is easy to digest for the baby, and it is readily available, it is affordable too, and it also boosts the immunity that is required for the baby very much. Like if we talk about the composition, which we have discussed in the previous videos, but just to uh, just to have a recapitulation, the composition of the breast milk has mostly lactose. It also has fats. Well, like when we were discussing the phases of the breast milk, we know that the hind milk that we have, they have the maximum amount of fat, resulting in the color of the liquid. Okay, so it has fat, it has proteins, and it has vitamins and minerals. Today, especially, we'll be talking about only the carbohydrates, protein, and the fat, and the importance of them in the breast milk. So what is the main calorie? It is about 65 to 70 kilocalorie per 100 ml of breast milk or 100 gram of breast milk, and the main source of calorie are glycogen. It is in the form of glucose and free fatty acids. So it is present higher in human breast milk, okay, than in cow's milk. The carbohydrate calorie is much more higher in the human breast milk than in cow's milk. So that's why it is readily digestible, and it is easy for the child to get all the nutrients very properly, and in present time properly digestible for the child. Now carbs is around 6.89 gram, which is giving to the calorie. Protein is about 1.03 gram to 1.1 gram, and fat is about 4.38 gram, which is actually giving to the 65 to 70 kilocalorie per 100 gram of the breast milk, which is given to the child. Coming to the carbohydrate which is present in the human milk, it is mainly lactose, and it increases with the amount of the milk volume. So as the milk volume increases, the lactose amount also increases. It also provides galactose. Now lactose, what is the main function of the lactose? Lactose helps in the absorption of magnesium, calcium, as well as amino acid. So when it is a cause of bone development, or when we are talking about bone development, this lactose is helping in the calcium and magnesium metabolism, and as well as amino acids. So that means growth, development, maintenance of the body tissues, everything is also helped by lactose. Okay, on the other hand, what is the main function of galactose which is provided by the human milk? Galactose is helping in the formation of the myelin sheath. Myelin sheath, as we know, it is a protective layer which is covering the nerve fibers, and it is actually helping the transmission of the nerve impulse. So when the nerve impulse is transmitted, it is helping The myelin sheath is helping in the nerve impulse transmission, and galactose is essential for the formation of that nerve impulse transmission. And galactolipids also, which is a compound lipid, you can say, this galactolipid is helping in the formation of the brain growth, or brain development is helped by them. So when we are having carbohydrate, the carbohydrate which is present in human milk, as we can understood, the galactose and the galactolipids, so it is involved in the brain and nervous system development, and also it decreases the level of dental caries development. So it decreases that level too. Coming to the protein, as you can see, there are so many important amino acids which are present in the breast milk, and it is a whole like bunch of the essential amino acids which are present in breast milk. So if we can see that the casein protein, which are hard, they are maximum 80% in case of the cow's milk, and which is actually 20% in case of human milk. And that is basically, it helps to digest. So human milk are easy to digest, and whey proteins are this much in case of cow's milk and this much in case of the human milk. So 80% of whey proteins and 20% of casein protein, which forms the hard curds, and that helps in the formation of the proper human milk, and also helps the human milk to be digested. And also the whey protein, they constitutes the lactalbumin and the lactoferrin, the alpha lactalbumin, which is easily digestible. This lactalbumin which is present, it has the similar amino acid pattern, which is the amino acid pattern, which is more like an essential amino acid pattern. So it helps to the body to absorb the amino acids, and also the functioning of the amino acid is better. What are the different kinds of essential amino acids which are present in the breast milk? Glutamic acid, it is there. Glycine is absent. The protein content is low. So the stress on the kidneys are very delicate now, so immature we can say. So kidneys stress are lower because the protein content are lower. Okay, so casein soft curds are 35%, and we can see the hard curds are more in case of the cows, less in case of the human. It is rich in the sulfur containing amino acid, and the cysteine to methionine ratio is high, which is very essential or beneficial for the infant. As I told you that few carbohydrates like the galactose, they help in the nerve impulse transmission by the formation of myelin sheath. So we also have one amino acid, that is taurine, which is an important neurotransmitter and neuromodulator, which helps the formation of brain and retina. And this taurine is present in high amount in the breast milk. One tryptophan, which is present in high amount in breast milk, it is needed for the serotonin synthesis. That is also very much required for the child's development, and that is abundantly present in breast milk. Any binding protein required, that is for thyroxine, corticosterol, vitamin D, folate, vitamin B12, anything, any binding protein, that is present in breast milk. So whenever when we will talk about the micronutrients too, so we need different binding proteins sometimes to make them available in the child's body, and that is present in the mother's milk. So that's why we say that exclusive breastfeeding till 6 months of age, because it is the ideal food and everything is present in the mother's milk. And amino acids, peptides, nucleic acids, all are present. Even the protein splitting enzymes are also present, so that it helps the protein to get denatured in the body, to get easily digestible in the body. So protein, which is such an important uh, macronutrient in the child's body, helping in growth and development, are in abundance in the breast milk. So breast milk is certain thing that should be given to the child. Around 1.1 gram percent protein is present in the human milk. Coming to another very important macronutrient, that is lipid. Lipids provide half calories in the human meal. So whatever the calorie requirement is, half of the calories is being produced by the lipid. So the mother's lipid content also determines the child's lipid intake. So if a very low fat diet with adequate protein, like if the maternal diet, it has a very low fat diet with an adequate carbohydrate and protein, or milk is rich in medium chain fatty acids. So that is also a very good composition, we can say. Breast milk is rich in unsaturated fatty acid, essential fatty acid. It has prostaglandin precursors, which are very good sources, fat soluble vitamins. So if fat soluble vitamins are not there, so these macronutrients will create a burden by not absorbing the fat soluble vitamins. So the macronutrient will not absorb the micronutrient, and there will be steroids, phospholipids, and the required cholesterol. Even the eicosapentaenoic acid and the docosahexaenoic acid, which are again important for brain development, are present in breast milk. Carnitine, which is a fatty acid carrier, it is required for fatty acid oxidation, that is also present in human milk, which helps the fatty acid to get oxidized. Cholesterol, again, it is required for the myelin sheath formation. The important thing is that the PUFA, like the polyunsaturated fatty acid is to the saturated fatty acid ratio is 1.2 is to 1, which is exactly the best ratio to get everything absorbed, like the fat absorbed, good fats to be absorbed in the body and do their functions. And also the main thing is that this fat which is present in the mother's milk gives the satiety to the child. They increases the satiety value of the child. So I hope you have understood the importance of the macronutrients which are present in the breast milk for the infants, and why we are focusing on exclusive breastfeeding to get the child available to these sources of nutrients which will help them in future, because we need to focus on the first 1,000 days of the life, which are very crucial. And we also need to focus on the maternal diet, because from the maternal diet only the nutrients will come to the child. The next video will definitely be on the advantages of breast milk, the micronutrient part. This was the macronutrient part. So stay tuned till we upload the next video. Support education, support Educatus. Thank you. That's all for today.